Welcome to the Module 2 of the Satellite Pharmacy Clerkship. Before we look in detail into the objectives of this module, I would like to just recap our memory regarding the medication management cycle or medication management system. As you all know now, there are three main processes that are involved in this cycle, which is preceded by the prescribing by the physician, and it will be followed by the dispensing by the pharmacist, and this is followed by the administration by the nurses. So what are the processes involved from prescribing until administration? This is what we're going to see in our current module. In this module, we are going to see what are the procedures of dispensing that are involved in the satellite pharmacy or inpatient pharmacy setting. I will go through in detail each of these steps one by one so that you can understand in detail. The first step that are involved in the procedure of dispensing is handling of medication trolley. So we are going to see how the medication trolley is being handled. Before that, I will tell you what is medication trolley and etc. Then we will go to in detail about medication order, followed by receiving and screening of prescription, and also charting of CMR. This will be followed by filling of prescription, and finally we will look into the countercheck of the supply. If you are still a member in unit dose system, all medications dispensed to patient in the ward should be kept in individually labeled drawer or tray or cart in the medication trolley for patients. The amount of medication dispensed should be according to the dosage regimen and placed in compartment within the patient drawer. The medication trolley must be lockable and key kept by a registered nurse in the specific ward and another by an authorized pharmacy staffs. So, what is medication trolley? Medication trolley is used in the hospital to organize and store medication as well as transport them to the wards and nearer to the patient bedside. Medication trolley can be divided into three sections or three parts. The top section is the place we call working station. It is where the drugs are compounded by the nurses. The middle section is the place where all the individual patient drug drawer or drug bin will be kept and arranged according to the bed numbers. And the lower section is the storage area to keep other medication related things. This is an example of the middle section of the medication trolley. It is written here Waterloo Healthcare because last time Waterloo is one of the brand of medication trolley that can be bought in the market. Basically, all the medication trolley should be sent to the pharmacy by the nurses on duty for the supply of new prescription and daily refilling of current prescription after dose administration times, usually at 8 a.m. So, every morning at 8 a.m., the medication trolley will be sent from the ward to the pharmacy department, which can be a satellite pharmacy or it could be the main pharmacy setting. And the trolley has to be collected by the ward staff before the next dose administration, which is at 12 noon. So it is very clear that the trolley should be sent back to the ward before 12 o'clock. Before transferring the trolley from pharmacy department to the ward staff will have to sign and record the time they are taking the trolley from the pharmacy department. All the documentation will be done in a special form provided by the pharmacy department. This is an example of forms that used to record the time the trolley is taken from the pharmacy department. In this form, it also written when the time the trolley was ready to be taken by the ward staffs. This slide shows that exact form that was used in the hospital for recording the trolley time when it's taken from the pharmacy department. You can notice here that most of the trolley is taken before 12 noon every day in this form. The second procedure which are involved in the drug dispensing is medication order. The medication order, or known as the prescription for ward patients, must be completed in the self-carbonized medication chart. You can see here in this slide, this is how a medication chart looks like. There are two sections in this, or two parts in this medication chart. One is a self-carbonized medication chart, which is yellow color. Another one is the actual prescription, which will be sent to the pharmacy department for them to supply the drug. All the medication chart should be signed by the prescriber according to the categories set by the Ministry of Health Malaysia Drug Formulary. This is an example of inpatient prescription, or it is also called as a CHIPS. There are 8 sections that need to be filled in each prescription. An important information is each prescription must be written with the generic name. Patient name and what or bed number is important feature in the first section. This will be followed by the date of the prescription is written and also the signature of the prescriber. There is also name of the drug should be written in one of the section, and the name should be written in the generic name, not in the brand name. Other information that can be seen in inpatient prescription is a complete dose. For example, here it can be either in milligram or milliliter, or it can also be international unit. The next section will be administration route, which is either O is for orally, or sometimes we call it PO. It can be local administration, IV, IM, and also subcutaneous or SC. The next will be the frequency of administration. OD is for daily, BD is for twice daily, TDS for 3 times daily, and QID for 4 times daily. The last one will be the treatment duration. Treatment duration is usually written as 5 over 7, so it is 5 days. If it is written 1 over 52, it means it's for 1 week. Sometimes it is also written as TR. TR means is still review. The prescription is valid until the patient is discharged from the ward. As I highlighted earlier, each prescription should be signed by the prescriber. It can be a medical officer, it can be houseman. However, there are certain prescriptions, such as the category A medications, should be stamped and also countersigned by relevant specialist or the consultant. Some medication, for example the control medication, we should have attached with application forms. For information, all the original prescription, which is the white color, should be sent to the pharmacy department, and the yellow copy will be kept in the ward. Each time the drug is administered to the patient, the nurses will record in the yellow copies. This slide shows the category of prescribers based on the Ministry of Health Drug Formulary. You can see here, category A is a consultant or specialist item. Category B is a medical officers, and C is paramedic staffs. Unfortunately, there is no pharmacy cannot prescribe in Malaysia. I'm going to tell you a 2 scenario how a prescription can be sent from the ward to the pharmacy department. First is newly admitted patient. When there is a newly admitted patient, the doctor will write the prescription or the medication order, and then they will send the prescription with the patient's cumulative record to the pharmacy department. If there is any changes in dose, dosages, form, or frequency of treatment or duration, it warrants a new prescription, right? And then they will attach with the advice note and send to the pharmacy department or satellite pharmacy. So basically, once it is a newly admitted patient, we have to attach together with the CMR and then send to the satellite pharmacy, and this can be done early in the morning together with the trolley. In other sense, if there is a dosage adjustment, daily dosage adjustment after the ward round, the doctors can send the prescription, or the nurses will send the prescription to the pharmacy department by attaching to the advice notes by saying there is increase in the dose, or there is a stop, they stop the medication, or they change to another medications. It is clear that the nurse on duty is responsible for sending prescription for all patients in the ward to the pharmacy. Under certain circumstances, the nurse can direct the penolong perawatan kesihatan or the PPK, those who are wearing the white color shirts, to send the prescription to the pharmacy. Third step involved in the procedure of dispensing is receiving and screening the prescription. Once a prescription is written by the prescriber, the nurse on duty will be responsible for sending the prescription for all patients in the ward to the pharmacy. Under certain circumstances, the nurses can direct the penolong perawatan kesihatan or the PPK, those who are wearing the white color shirt in the hospital, to send the prescription to the pharmacy. So when you receive a prescription, what we should do? We should receive the prescription and we should screen it. All the prescriptions received must be checked by the pharmacist or pharmacy assistant to ensure that they are complete. Prescription screening is a systematic process of assessing the prescription ordered by the physician. This process is conducted by the pharmacy before medicines are dispensed to the patient. During screening, the pharmacy will ensure the prescription is valid and authentic in addition to identifying any prescribing error. The first thing that we should do when we receive a prescription is to check the authenticity of the prescription or the prescriber. If the prescription is not signed by a prescriber, I think there's no point of checking the other things because the prescription is not valid. Once the prescriber signature is there, we have to check whether the prescription needs a stamp or not. A consultant or specialist item need a stamp and also signature by the consultant or specialist. For example, if it is a category A medication. Make sure the prescription adhere to the Ministry of Health Malaysia drug formulary. The next thing that you have to check is the patient name and also bed number. There will be lots of patients that you have to handle. Some patients will have, some names are very familiar in the ward. For example, Bala. There will be a lot of patients with the name Bala. So you have to make sure that each patient is specific for the prescription and also in specific bed number. Also, in addition, we as a pharmacist should also check for the name of the drug, whether the drug is written in a proper spelling, and it should be in a generic name. After checking the name of the drug, we should check for the suitability of the dosing regimen. This includes the dose, route, frequency, and also the duration. Make sure all these are appropriate. In addition, we also have a duty to check the drug interaction, any polypharmacy, and also correct medication administration method and also the other things. In case if you receive a problematic prescription or incomplete prescription, it is your responsibility as a pharmacist to contact the MO or the medical officer or the nurses for clarification. Or sometimes we can also issue an intervention note. You can see a scenario of how to contact a doctor in a video that will be attached in this module later. Any intervention made should be recorded in the notes column of the CMR. What is CMR? We will talk about this in a while, but at the moment just assume that whenever there is an intervention, you have to write in the note column in the CMR. Remember one important thing, any changes or any clarification made to the prescription can only be made with the prior consent of the prescriber concerned or the prescriber who write the prescription, and recorded in the note column of the CMR as I told you earlier. If the counter signature for category A medication has not been obtained, the prescription should be copied into the CMR and the medication supplied first while waiting for the counter signature. The intervention note that states the necessity for the specialist signature should be sent to the ward with the prescription. After it is signed, the prescription will be returned to the pharmacy to be pasted on the CMR later. This is how an intervention advice will look like. There are several categories here where you can choose or you can tick before you send the prescription with the problematic prescription to the ward. This is an example how you can fill in the intervention advice. You can see here you receive an inpatient prescription which is clopidogrel 75 mg oral daily for 1 week. What is the problem here? The problem here, clopidogrel is a list A drug, so it has to have a specialist counter signature, specialist or consultant counter signature. So what you have to do is attach this to this intervention advice and take specialist signature required and send to the ward together with the medication trolley, and later the doctors in the ward will sign it and send back to you. This is another example where the picture was taken in the hospital. You can see here on the right hand side, the patient was given a felodipine. Actually in the real, it is not fedipine. Felodipine is a calcium channel blocker, right? We can see the dose, the spelling is wrong. and you can see here the dose is 5 mg oral daily. This is a common dose for felodipine. So we want to clarify the drug name, so we just attach the prescription and send to the ward by taking the clarified drug names. Now we have received the prescription and we have screened the prescription, and if in case there is a problem, we will send the prescription back to the ward. So once we receive the prescription, what are we going to do now? The next thing that we will do is charting the cumulative medical record. All new prescriptions which have been screened should be pasted on the patient's cumulative medical record, or it is also known as CMR. This is how a cumulative medical record or CMR looks like. This is what will be kept in the pharmacy department or the satellite pharmacy. There are several things that you have to know in a CMR. There are a few components here. One is the patient particular of patient informations, the basic information of patient for us to recognize the patient. There are also another section whereby the medication record is written here. The first column here is the medication record. This is a place where all the inpatient pharmacy prescription, the small prescription, will be pasted. The second column is the date, and the third column is amount. So the dates is, I will tell you later what is the function of the second and also the third column. And you can see here the last column is about the note. Remember I told you earlier, when there is an intervention need to be done for the prescription, you will send to the doctors to the ward and write a note here. So this is where you will write the note. Basically what you guys will do is, once you receive a prescription, we will take all the new prescription or any new prescription with the changes, and paste it on the CMR, on the section whereby it is written medication record here. Once it is pasted, we will check for the expiry date of the prescription and record it in the amount column. Now I'm going to teach you how to do a CMR charting. This is a very easy process, just we have to understand the process in detail, okay? Let's assume we receive a prescription now is the pantoprazole 40 mg oral daily. We check the name, we check the bed number, and we check every single thing. We screen the prescription, and after we screen we found there is no mistake, and then we take the prescription, the chips, and we paste them into the medication record, CMR. Once you have pasted, you have to write the date and also the amount of medication, and the frequency supplied for the day should be written in the amount column of the CMR. The example here is pantoprazole 40 mg OD. So what you have to write here is 1 times 1. The first one is for the number of tablet, because pantoprazole is a capsule, there is only one capsule, 40 mg capsule. So we write there 1. The second is the frequency of the administration. Here the example is OD, right? OD is a daily, so it's once daily. That's why we write 1 times 1. If you receive a prescription for diclofenac 50 mg TDS, then what you will write here is 1 times 3. 1 is the number, the tablet. The strength of a tablet is 50 mg. Strength of a diclofenac tablet is 50 mg, and TDS is 3 times daily. So you will write here under the amount section 1 times 3. So basically what we will do is, for each prescription, we will paste the prescription, we will start writing, or we do charting of CMR for each single prescription. Well, this scenario will happen if there is a new patient. Now let's assume that there is a what you call old patient in the ward, and the doctor send a new prescription, or they send a note saying that the drug should be stopped. So what we should do is, we should stamp or cancel the prescription and write the ubat diberhentikan. So basically, to discontinue a medication, the prescription at the CMR must be stamped with ubat diberhentikan. At the medication chart or in the yellow copy in the ward, the prescriber or the pharmacist or the nurses can record the discontinuation of the medication in the yellow copy. So now everyone is aware that the medication has been stopped. There are other scenarios. For example, if the doctor wants to withhold a medication, let's assume that patient is prescribed with the potassium chloride, and the potassium level is high, is more than 5.0 millimole per liter, and they decided to withhold the medication. In this scenario, to withhold medication, it also must be recorded as WH in the CMR. This will be recorded at the amount section. The same should be done for the medication chart in the ward, which should be done by the doctor or pharmacist or the nurses. Other scenario is when there is a changes in the medication dose or the administration frequency need to be stamped with rujuk prescripsi baru. So let's assume that we have received a new prescription with a higher dose as compared to the previous one. We just cancel the previous prescription and we chop there rujuk prescription baru, and we will paste the new prescription and we will supply the drug based on that. Can you follow what I'm telling you guys now? Well, if it's not understandable, let's go for a real example. Now I'm going to show you a real prescription is given to a patient named Balamurugan here. This patient was prescribed with aspirin, perindropil and also mixture of potassium citrate. So when you receive the prescription, you have to screen it, and after you screen, you have to stamp to the paste it to the CMR. So once you paste it, you have to do the charting of the CMR. Now let us see for the tablet aspirin. Tablet aspirin, once the strength of tablet aspirin is 300 mg. So we are going to give the patient half tablet daily. 150 mg is half of the tablet and OD is daily, right? And the duration is TR. So what you have to do is, if you are supplying the drug on 11th of September here, because the date of the prescription is 11, on that day you supply the drug and you should write there half times 1. Half is representing the tablet that is being supplied, and 1 is the frequency of the drug is given supply. So half times 1. Okay, that is first example. The second prescription is tablet perindropil. It's 4 mg OD. 1 tablet prescription, the strength of 1 tablet of perindropil is 4 mg. So you just write there 11 of September and you write there 1 times 1. It's very straightforward. One thing that you have to see here is the duration of the prescription of this particular prescription is only for 1 week. 1/52 is 1 week, right? So what we have to do is we have to write like a 7 here. You have to cancel the remaining of the column so that the nurses in the ward cannot write the prescription later on actually. Is it clear? Okay, the third example here is mixture of potassium citrate. The reason I give this example is for you to see if it is an oral solution is given to the patient. I'm sure now you know that in unit dose we will pack them in a container or in a small bottle as 10 ml. So here the strength of the mixture potassium is 10 ml and it is given 3 times daily only for 3 days. So what you have to do here is write 10 ml times 3, and after 3 days, because each row is representing a day here. So the row 1 is what you have written here on 11th of September. So after 3 days, you just calculate after 3 days, you cancel the prescription. You cancel the remaining rows. It means no one can supply the medication after 3 days. Is it clear? The example that I gave you earlier is only for a prescription is supplied for 1 day. Now let us see the example a prescription is being supplied for almost a week now. So you can see here the same patient is given tablet aspirin and he was in the ward for almost 1 week at the moment. And in the middle of on 11th of September, he was also prescribed with cloxacillin now, and also Mr. Potassium citrate is still on the prescription. You can see here after 5 days of admission in the ward, which is on 15th of September, the aspirin tablet was discontinued. As I told you earlier, when the tablet is discontinued, you have to stop and you must chop or stamp with ubat diberhentikan. The stamp will be available in the pharmacy department. And the second prescription is cloxacillin. Cloxacillin is an antibiotic and usually it will be prescribed for 1 week, right? You can see here the patient is given 2 times 4, which is 1 strength of cloxacillin capsule is 250 mg. So we have to give for 500, we have to give 2 capsules, and it is given 4 times daily. On 16th of September, you can notice here, on 16th of September, it seems like the doctor withhold the medication. There could be some reason. So what we have to write there is WH is withhold. But fortunately, the drug was restarted again on 17th of September, the drug was given. Because the prescription is valid only for 1 week, so after this we can't supply the medication on 18th of September. Let's assume his patient is still in the ward on 18th, we can't supply. We have to ask for a new prescription and paste it into our CMR. Is it clear? So another example here, mixture potassium citrate. It is given only for 3 days. After that, you already cancelled earlier, remember? So we cannot supply it anymore. Well, I hope you understand now how to do a CMR charting. This is very important because you will start doing CMR charting when you become pharmacist later. It is also will be used in the activity in our lab later on. Just an example of slide for you to see how the CMR looks like in a real world. Well, one thing that we have to know is for prescription, which is written for intravenous preparation or subcutaneous preparation, injection preparation basically, it should be pasted on the last row of the CMR and in the second page. Second page means the CMR usually there is a front page and also the back page, right? So what you have to do for injection preparation, you have to stick the CMR on the lowest row of the CMR, and we have to write the amount from there. This is easier for us to recognize whether which is a what you call intravenous preparation and which one is oral preparation. Just a quick recap of what I've told you so far. I've told you how does a medication trolley looks like and how we can handle the medication trolley, and then we have seen how does a medication order looks like or inpatient prescription, and when you receive a prescription you should screen the prescription. We have discussed in detail what are the things should be screened in a prescription, and if there is a problem, how to do the intervention of the prescription. And later I was describing to you how to do CMR charting. Now let us see the next process in the procedure of the dispensing, which is filling of prescription. So the fifth process in the dispensing procedure is filling of prescription. All medications supplied to the ward must be in ready-to-use form in a container meant to administer of one dose and not exceeding the requirement for 24 hours. Remember, what is this? This is the characteristic of the Unidose system, right? So it is very clear. Okay, we are going to supply the medicine only for 1 day. The filling of prescription should be done by the pharmacist, or sometimes it also can be done by the pharmacy assistant. Usually, the PRP will do it. When one pharmacy fill the prescription or fill the drug into the drug bin, another pharmacy should countercheck. So basically, to tell you the scenario, if pharmacy named Bala is the person who filled the prescription, another pharmacy with another different person, it can be a pharmacist Baharuddin, he will come and countercheck the filling of the prescription. Remember, filling has to be done for all new prescription and also current prescription in the CMR. The staff filling the bins or the medication cart have to sign the Unidose dispensing checklist. I will show you the checklist later. And one bin is allocated for a patient. This is an example of a drug bin it is given for one patient in ward C11. You can see here each patient will have their own individual drug bin. And this is how the drug bin looks like in aerial view. You can see here there are certain compartments in the drug bin. It shows the drug timing. So one bin is allocated per patient, as I told you earlier, and each bin must be filled with the medication prescribed with the correct quantity based on the CMR that was filled earlier and in accordance with the administration time. This slide shows the time for the filling of prescription. The example of administration time, for example, if the drug is given 4 hourly, then you have to fill the prescription at 6 a.m., 10 a.m., 2 p.m., 6 p.m., 10 p.m. and 2 a.m. If the drug is given ON, we will give the drug at 10 p.m. If it is BD, it will be at 8 a.m. and 8 p.m. It is TDS, is 8 a.m., 8 p.m. and is 2 p.m. Just one thing that I forgot to tell you, that pharmacy staff has to ensure the cleanliness of the medication trolley and also the bins. All bins must be emptied before filling is done. It means that for new patient, the bin will be empty anyway. For the patients who have been already in the ward, we will receive the bin in the morning in the medication trolley. Once we receive the bin, we will empty all the bins, take out all the medication that was not taken by the patient, and then we will fill the prescription and new medications. If there is a balance of medication in the patient bin and no advice note is given, sometimes we can ask the explanation from the nurse on duty in the ward concerned has to be obtained, and also it should be recorded in the CMR. Maybe they didn't give the medication to the patient because the patient is very severe and is NBM, known by oral. Just a quick note here. You can see here that we will arrange the medication based on the time allocated, right? So you can see the first dose is at 2 p.m. here. So if the patient is given TDS, so we will give medication at 8 a.m., 2 p.m. and 8 p.m. And here the first dose of the day, which is assumed first dose of the day after the trolley is received by the ward. I told you earlier, all the trolley must be sent to the ward for the first dose at 12 p.m. So let's assume the patient does not have a 12 p.m. dosage and the patient is having 2 p.m. dose. So we have to put the 2 p.m. in the front, and the drug should be filled in front of the 2 p.m. slot. For PRN medication, the drug should be placed at the furthest end of the patient's bin. It will be at the end of the bin. For dispensing of medications such as ointment, lotion, eye drops or ear drop solutions or sometimes creams, the total volume or the weight supplied must be recorded in the amount column and stamped with telah dibekalkan pada. For example, here the patient is given zinc oxide 30% ointment and the drug was supplied on 11th of September. We put 30 gram of ointment was supplied. This is how we supply for this kind of solutions. On the other hand, filling of prescriptions involving psychotropic medications, exchange basis drugs and floor stock item need not to be done in a unique dose manner, and the prescription should be stamped with exchange basis, use psychotropic stocks or use floor stock. This is easy for the pharmacy to supply the drug. In certain cases, as I told you earlier, after the prescription have been supplied in full, we can stamp it using the stamp of Selassie. And for prescription where these dosage forms of the medications are changed from injection to oral, usually the example will be antibiotics, the change to oral stamp should be used and vice versa. In certain cases, the physician can prescribe PRN doses to the patient. So if the patient is given PRN doses, the medicines are placed at the back of the individual bin. Let's take an example here is table paracetamol 1 gram PRN. There are one thing you have to know. Paracetamol, the strength of tablet paracetamol is 500 milligram. So if the patient is given 1 gram, we are going to use 2 tablets at one time. PRN, the maximum frequency of paracetamol is 4 times daily. So 2 times 4 is 8 tablets. So now we have 8 tablets for this patient, right? 1 gram PRN. So on the first day, the amount of doses should be supplied to the patient is recorded as plus 8 because we are going to supply 8 tablets for the patient. Okay, and for the subsequent days, only the amount of doses added need to be recorded. So let's assume that on the 1st of September, the patient used only 4 tablets. So when the drug bin is sent to the pharmacy, we found there is only 4 tablets left. So we will add in another 4 tablets. That's why it's written in the amount section, you should write plus 4. On 2nd of September, assuming the patient is only used 2 tablets, then when we receive the bin on the 3rd of September in the morning, we will see that 6 tablets are still available in the patient bin. So we supply an additional 2 tablets. So we can write here plus 2. This is how we supply PRN doses. So now we already know how to filling medication into the patient bin. So the staff filling the bins have to sign the unit dose dispensing checklist. This is the form of unit dose daily dispensing checklist you can see here. So there is a date and also who was charting the CMR, and another person should be dispensed by whom. It should be signed there and checked by another person. As I told you earlier, there are 3 different individuals should be doing this actually. Person who are charting should be different from dispensing, and the counter check should be different as well. You also must write there the total number of prescription with error if in case, and later I will talk about this when it's come to counter check section. So once all the bins are ready, we can arrange all the patient bins according to the bed number. Usually the injection bin will be kept at the upper right hand side, but other bins are all based on patient bed number. For medication that cannot be supplied using Unidose system, we can supply the drug by using flow stock system. For example here, controlled substance, a drug that has substantial potential for abuse, must be securely stored in the pharmacy. We can't supply them by using Unidose system. Anti-cancer agent, inhalers, eye or ear drop disinfectant should be supplied using a different method. This is an example of how to order the IV preparations or IV injections. We can use an indent form for supply medication by using flow stock system. This is what example was taken from Hospital Pulau Pinang. You can see here there is an indent being sent by a ward here, which is C5, IV adrenaline, IV atropine, noradrenaline, dopamine and laxis. They will write there the quantity of amount that is been ordered, and we will supply based on the what needed. So and then we will record the amount is being supplied there. And then before the nurses take this medication from the pharmacy or satellite pharmacy, they will sign and double confirm before they take it. Another example of indent form for flow stock item including tablets which are ferrous fumarate and tablet B complex and folic acid. All these tablets are being supplied by using flow stock system because this is commonly used in medical ward. So just for an example for you guys to see actually. As I told you earlier, for controlled substances, the drugs cannot be supplied or stored in individual patient bins in the medication cart. There is simply because there is no security for the control of the medication. Anyone can take the medicine, right? Usually, the controlled substance item will be stored in a locked cabinet with limited access in the ward. Pharmacy will place a bulk medication into this locked area, and the nurse could obtain needed doses provided they have a proper documentation. So, accurate inventory and documentation is vital in the supply of controlled substances. As for the as-needed medication or PRN medication, the drug can be kept in the pharmacy and dispensed them upon request by having a flow stock drugs, we call it. This system had most control over the medication distribution, but the time intensive for nurse and pharmacists and led to delay in administration. Another method is as what I told you earlier, remember? We send up a small amount of medication for each patient in their medication drawer at the end of the drug bin. If the patient requested a dose, or the nurse would retrieve the medication for the medication cart and supply to the patient. For as-needed medication, most hospitals will use limited flow stock system. The medications with low potential for misuse and patient harm, such as laxative and antacids, will be stored in small quantity in the medication cart or medication bin. Medication would be in the Unidose form if it is the hospital have a small bottle to pack this kind of items. The supply of emergency medication for emergency is also quite different. Medications need to be available instantly in order to assist the reviving the patient's condition. So in this case, a selective number of medicines were provided in a tray or kit in ready to administer form. We call it emergency tray. Usually it will be kept at the lower part of the medication trolley. This medication kit will be available on all nursing units for immediate access. We will discuss in detail about the emergency medication in another section. So in this picture you can see how the flow stock item including injection item will be supplied in the ward. The thing that is kept above the medication trolley is the place where we keep all the injection and also flow stock item. It looks like a fishing tray, but this is how the hospital have make an innovation in the way they supply the medication flow stock item in the hospital, Pulau Pinang. Well, now we already know how the prescribers will write the medication order, and as a pharmacist, how we receive and screen the prescription. And once we screen the prescription, we will do the charting of CMR. And after that, we do the filling of medications. After filling of medication or after dispensing the medication into the drug bin, we should do a countercheck supply. This is the last process involved in the cycle here, the countercheck supply. Well, now we already know how the prescribers will write the medication order, And as a pharmacist, how we receive and screen the prescription, and once we screen the prescription, we will do the charting of CMR, and after that we do the filling of medications. After filling of medication or after dispensing the medication into the drug bin, we should do a countercheck supply. This is the last process involved in the cycle here, the countercheck supply. For checking of the supply, or we also call as countercheck, all the unit dose medications supply must be counterchecked by a different pharmacy staff from the one who did the filling. This I already highlighted it earlier, right? All medication filling and counterchecking process must be done before the trolley collection time, which is 12 noon. This is also that I have highlighted to you. The nurses on duty should check the supply received and inform the pharmacy if there are any discrepancies. This is the responsibility of the nurses to check the drug bin supply. But remember, before it's been sent to the ward, we already countercheck it. But right, there shouldn't be any discrepancy. After checking the supply, the nurses on duty should receive the medication trolley and acknowledge receipt in a form according to the requirement of individual hospitals. And all the fillings of errors need to be corrected and recorded for the purpose of quality assurance purposes monitoring in every hospitals. So please document whatever error is identified. I will show you the form for the error documentation in a while. This is how a trolley with full drug bins and also with injection item on top is ready for being sent to the ward. This is the unit dose dispensing checklist that I told you earlier. There are a few types of error that is stated here, so we just have to tick if there is any error. For example, if the drug which is in the wrong drug was supplied in the drug bin, then we can tick there 1 so that later we will know how many errors were done in a month. Documentation is useful for quality assurance monitoring program, whereby we can compile that and we learn from the mistake that we have done. So now the trolley is ready to be sent to the ward. What do you have to do? Do you still remember? Yes, when the nurse is coming to take over the trolley, they have to sign and record in this form to say what time they have taken the trolley. Everything is being done in hospital is being recorded for the purpose of proper quality assurance monitoring. Well, I already gone through all the 6 procedures of dispensing that are involved in the pharmacy department. I hope you will take time to go back again if you don't understand and listen carefully how to do all this procedure individually. Usually, we as a pharmacist will be responsible of doing all these things in the hospital later on. Thank you for me now. Bye.